Hello and welcome to Health Optimization Treatment. My name is Alicia Jones and I will be showing you how to reconstitute or mix your peptides, including HCG, BPC, and more. First, you will want to make sure that you have all your supplies ready. You will want to wash your hands or at least use a hand sanitizer. Gloves preferred if you do have them. If not, please make sure your hands are washed. You do want to have a sharps container or another device that you can safely put your sharps in. Some people do utilize an empty laundry container or a hard plastic bottle. Sharps containers are pretty cheap. You can even get them at Walgreens or some of your local retail stores. Your container package, you will also have alcohol swabs. You will have your medications. Within your box, it is important to note your HCG and bacteriostatic water are both in the same box. Some people do tend to miss that, but they are both in there. If you get another package with a peptide, the bacteriostatic water as well as your supplies will always be shipped with you in the same package. You'll have your syringes, so you should have a bigger syringe. This is with milliliter markings. So as you can see, there is 10 milliliter markers on this. Each number that you go to is 1 milliliter. The other bag of syringes you'll have will be much smaller. These are called insulin syringes, but they are much smaller. These will be the ones that you'll actually be injecting with. So first what you'll do is pop the top of that bacteriostatic water, and then you'll clean that. On this bigger syringe, we are going to pull that all the way down to the 6. So that would be 6 milliliters, and that is the amount of bacteriostatic water we will be utilizing. So you will put that in there and let the air go in, and that helps it draw back a lot quicker for you and easier. And then you'll just be pulling that all the way down to the 6 milliliter mark. Sometimes you might have to go down a little lower and push it back up, and that will kind of help some of those bubbles that you might get. If need to, you can just push it all the way back up and pull it down again as well. So as you can see, we pulled that to the 6. And now with that, we're also going to clean off the top of that HCG vial. And with this, one thing that is really important is whenever we put that in there, it's going to automatically start pulling down. You do want to be pretty gentle with peptides. You don't want to be super harsh or rough. So just, if it doesn't automatically pull down, just gently push that in. There are 12,000 IUs of HCG in your vial. We are adding in 6 milliliters of bacteriostatic water, so that's going to make that concentration 2,000 IUs of HCG per vial. So with this, I'm just withdrawing out that extra air. And then we'll want to safely dispose of that needle. So you'll be able to see as well, when that mixes, it actually mixes pretty quickly, pretty easily. You do not want to shake your vial. If you notice that there's any kind of powder that has not dissolved yet, sometimes you can gently roll it in your hand. But again, no shaking. Peptides are very fragile. Like I said earlier, they're also very temperature sensitive. So once they're mixed, if they haven't been mixed yet, the temperature is not as big of a deal. But once it is mixed, it's extremely important that you put it back in the box and make sure that it stays refrigerated. That's because you want it to be protected from light and you want it to be within the right temperature. So as far as withdrawing your dose, most people do need around 25 units. How often you do that is going to depend on your particular situation. But in order to stimulate that reaction, usually 25 units or 500 IUs is going to be the minimum to get that message. So with this, you can as well draw back 25 units. So with these markings, each one is 1 unit. Each of the little tiny black markings is 1 unit. So that would be 25 units. Some people may need different doses. So if you may potentially be getting 30 units or 50 units. And in that case, you would withdraw it to the 30 or the 50. You can pull down a little bit further if you need to. If you notice any kind of air bubbles, if you flick it, it will usually rise up. Another really important thing is whenever you're withdrawing, make sure that the vial is on top and upside down and your syringe is pulling down from it. If you do it this opposite way, you're going to be getting a lot of air. So there we go, 25 units. And this would be done with what is called a sub-Q injection, which is what is often abbreviated as, or subcutaneous. And what that means is in the fat. Sub-Q is in the fat. So places that you can go are the back of your arms, your abdomen, your thigh. It's generally easiest for most people to go in the abdomen. So what you'll do is you really just kind of pinch in a little bit of fat, cleaning that off. Then you'll go in at like a 90-degree angle. Again, then the fat, and then you're pushing in. They're very, very tiny. You really can't even feel it. You really shouldn't bleed. It's really, really painless and easy. You do want to make sure you're at least an inch away from your belly button when injecting and that you rotate sites. You do have that whole abdominal area you can utilize, so just make sure that you are changing around where you're going and you're not using the exact same spot every time, just because that over years that can cause some scar tissue buildup, so we do want to prevent that. It is best to do your HCG in the morning if possible. That aligns more with how testosterone naturally boosts in the morning. So you want to inject it in the morning and preferably the day before your testosterone injection. HCG is essential for not only protecting but also increasing your natural production. And that is going to be able to especially protect it best if you're doing it the day before, so it's not as suppressed or hindered. So we really want to increase up that natural testosterone production as well as protect it from being decreased while you're on treatment. HCG is used for a variety of different ways. Some people can use it for fertility. It can help increase that. Most importantly, with TRT, we will often be using it as far as increasing and protecting that natural production. And once again, whenever you're done, just kind of drop that HCG back in the box, put it in the refrigerator, And that's all. Let me know if you have any questions. You can always reach out. Our website is www.hottooptimize.me. Phone number is 573-652-3565. Look forward to hearing from you. Have a great day.